Hello, this is a video about egg donation. This has been provided by Brooklyn Abel, who is one of our coordinators at Guidance. And just as a heads up, this is in no way medical advice or direction by a medical professional. This is based on our experience and should be considered informative, but not medical advice. So there are two types of egg donation, open and anonymous. In open donations, the intended parents and the donor most likely meet, sometimes in person or by video call. They share contact information or have some or complete communication, and everyone's identity is known. We do not share the identity until after contracts. So there may be some communication facilitated by us, but we do not release identity or contact information until there's a contract in place to protect everybody. Anonymous donations are more popular. I would say about 98% of our cycles are with anonymous donors. In anonymous donors, your identifying information is not provided to the intended parents and vice versa. Intended parents will only see an anonymous profile. It's actually the case in open donation too. Parents only see an anonymous profile unless they're entering an open donation, at which time that information is shared at contracts, but profiles are always anonymous. So again, in anonymous donations, identities are kept private. The only people who do have your true information are the agencies and the attorneys and the doctors. So there has been some confusion online in the past about anonymous donation. You are not anonymous to an agency. That's impossible. We have to know who you are. The anonymity applies to the intended parents that are the recipients of the eggs. You're welcome to choose whatever type of donation you would like. Sometimes people's decision evolves over time, and we're here to advocate for whatever choice you like. But closed anonymous donations tend to be the more popular choice. A lot of people leave room in their contracts to change their mind, which means they can contact us to see if the other party has also changed their mind in the future. But if not, that means the contract that was executed is still upheld. So there is some room for change, but the default is always what you originally agreed to, unless both parties agree to a change in the future. This does not allow you to not provide any updates to us, the agency, if there are any changes in your medical history in the future. So we do have the right to contact you, as well as the parents have the right to contact you as mediated by an attorney in the future about your health history to make sure that there's nothing significant or nothing has changed that should be of concern for their child that has that genetic connection. So who and why might someone consider using an egg donor? So there are many reasons. One is if there's a potential risk to transmit a genetic disease to the child, they may need an egg donor. If the intended mother has poor quality of eggs and has therefore not been able to conceive, either naturally or through IVF. Many women, unfortunately, face premature ovarian failure, which puts them into menopause earlier than usual. They may have a diminished ovarian reserve, a history of pregnancy failures, same-sex couples, older individuals, which really isn't too much older. Sometimes they can be closer in age than you think, at which point their body just naturally puts them in a diminished ovarian reserve or poor quality eggs, as well as single fathers. We call them single parents by choice or single fathers by choice. So who can be an egg donor for Guidance? Typically, a first-time donor is between the ages of 21 and 28 years old. If you have been a donor before, you can typically donate up until 32 years old. So your application will be accepted if you're a proven donor beyond 28. We can accept profiles or applications at 18 years old, but you're not likely to find a match quickly, as most clinics require donors to be 21. So you can start considering it and see if options present themselves, but it's likely not going to happen until you're 21. BMI under 28, some clinics are flexible about that being under 30, and they are considerate about height because it isn't the best indicator, we all know, but it is something they use. If you are significantly over 30 BMI, it's less likely to happen, unfortunately. You do have to be able to respond within 24 hours. Streamlined, smooth communication is what we look for most in donors because we do need you to respond to time-sensitive information very quickly. You have regular monthly periods that may be changed if you're on a certain form of birth control, but you do have to have a history of healthy cycles and healthy periods, whether or not you're taking a birth control that interrupts that. You cannot be on DEPO, which is the injection birth control, or have a hormonal IUD in place, and you cannot have any of the implants that are typically in your arm. You can't have a history of reproductive disorders or abnormalities, including in your family history, and you have to be extremely physically and emotionally healthy. You have to be flexible for travel and frequent appointments. There is really no way around this unless you narrow down your options for only local cycles. As most are travel, you do have to be able to travel and make it to quite a few appointments that are dictated about a month in advance and aren't flexible once you get started and you're in a calendar. To find more information about the travel requirements, you can go under our FAQ on the website and get a better breakdown of the travel that you can expect. You have to be a non-smoker and drug-free, willing to undergo the medical, genetic, and psychological evaluation, as well as understand that this process requires the use of medications administered by needles, so injections. There is no way around that. That just is part of the process in this day and age. So you do have to be comfortable with self-administered injections. Most of them are subcutaneous. You can look up what that means, which means it's very small and tolerable and easy to do yourself. But if that's something you don't see yourself doing, unfortunately, it probably isn't the best fit for you. Unless you have someone close by who can do them for you, which fortunately we haven't seen, or fortunately we haven't seen that too often, but it would have to be where they're there. These medications are very time sensitive, so you'd have to have a very trusted person to help you with that. So why donate your eggs? So everyone here at Guidance has been a donor until the max amount of times we are able to donate. So we all have been in your shoes with clinics all over the country, and we are passionate about it, and that's why we're here to help you and guide you on a positive and healthy and rewarding experience. We know exactly what it's like to be in your shoes. So a few of the reasons, there are many reasons why people choose to donate, but these are the more common ones, as well as our personal beliefs and our own experience and why we pursue egg donation. So first and foremost is empathy and generosity. Many individuals seeking the help of an egg donor have already went through the pain and suffering to only discover that their own eggs will not work, or they have a genetic issue that makes it impossible. Or they may be same-sex couple who can't have a child without the use of an egg donor. For many donors, knowing that they are part of making a family's dreams come true is on the forefront of the decision to become an egg donor. Secondly, going through the egg donation process can provide amazing insight into your own fertility. The screening test can provide you a solid foundation for your future goals. So you do have rights to your medical records, no matter where that is or who's paying for it, so you can have copies of all this information. You also undergo extensive genetic testing that most people would not do. Not the genetic heritage testing you see at the drugstore, but the disease panels for genetic concerns that are congenital or inherited. Is a quite expensive test, and you are getting that done on you. The panel varies based on the clinic you work with, but that is your right to know, and that knowledge is your power once you have it completed. And finally, The financial rewards are significant with donating your eggs. At least in the US, it does vary in other places, but here with us, our cycles are completed in the States. So there is a financial component to egg donation. The intendeds technically pay for your pain and suffering in the form of a gift. So it is not payment or transactional for your eggs themselves. That is illegal. You cannot purchase tissue in the US. So it is for going through all those injections, appointments, and making it through the retrieval. To learn more about how compensation works, you can go to our FAQ on the website. A little bit about my story. I was inspired to become an egg donor because of my big sister. She did it first. And if it wasn't for egg donation, I wouldn't have been able to finish college. It helped me pave my way and let me complete my degree. So not only did I get to help families and get that amazing reward, knowing that I helped them achieve pregnancy and healthy births, I was able to complete my higher education, and I know that is a common story for a lot of donors. So the timeline, this is an estimate. This is just a ballpark of what we anticipate, what's pretty average, but this can skew based on individual experience and the variables going on in your match. This is a heavy process with a lot of variables, so you do have to be pretty patient and flexible when taking on this journey. It does not happen quickly, so you have to take that into consideration especially when you are applying. So initially, when you're signing up for our program, it can take 1 to 2 weeks. That really just depends on how quickly you get through the application, education, and your screening interviews. So the quicker you interview and meet those application deadlines and requirements, the faster that is. So it can be about a week if you are on top of it and have the time. So once you complete all that intake information and accept it into the program and meet all the requirements, you go into matching. Matching does significantly vary by donor. It's all about the right parents at the right time looking for someone just like you. So you do have to be patient with that. We'll go into more of this later, but getting the first journey, your first match, is probably the most difficult, and we'll go into that more later. After matching, once you've been matched with a family, you will complete psychological and medical screening at lightning speed. That takes 6 to 8 weeks. Can be a little bit slower, just depends on how quickly the clinic gets you in for these appointments. The faster they get you in, of course, the faster you're done. But these are typically time specific to your menstrual cycle, so we also have to take that into consideration. So medical screening is normally one appointment, and then psychological is another appointment. Some clinics do them both at the same time. After you have cleared psych and medical, and you have medical clearance, you enter into legal, where you'll complete your legal agreement with the intended parents, which we'll go over more in just a little bit. That can take 1 to 2 weeks. Again, that is a fairly quick turnaround. It can be longer. That just depends on how busy the attorneys are. And if there are any negotiations that happened later and weren't addressed in matching. We do our best to address all of the legal parameters beforehand so we can have a quick turnaround with contracts. We're not dealing with a bunch of negotiations back and forth. But that is the time and place where that can happen. Once you have legal clearance, that means both you and the intended parents have executed a contract together. You actually begin the cycle. When the legal clearance is issued, the clinic will provide you a medication calendar to start stimulation. And under this same process, you have your appointments and the egg retrieval itself. So we'll go into each of those a little bit more. So these are the steps we're going to go into in more detail because these are the big ones. It's a smooth process because you have coordinators to guide you every step of the way. So it may seem like a lot, but you're never left alone and never left to feel confused or uninformed. So first step, matching, then screening, then your contract, called the donor contract or legal, your stimulation, with the actual medications and the egg retrieval itself. Let's start with matching. So matching. As I said, after completing your application materials, intended parents can begin viewing your profile. It's important to keep in mind that different families are looking for different things, but often they're interested in a donor who's physically, mentally, and personality-wise aligned with their own. This also goes into ethnicity and ancestry. A lot of people are hoping to find someone with that genetic ancestry that they themselves are unable to pass down. There are many, many variables into a parent's decision in this process. Let's see what else. It is hard to know how long the process will take. Typically, the first donation is the hardest one to secure. The reason for that is they've already been through quite a bit most of the time, and they gravitate towards proven donors. Proven donors offer some tiny peace of mind that they're likely to be a successful cycle again, versus first-time donors are a little bit of an unknown. So many parents are open-minded that a first-time donor might be a proven donor, a great proven donor in the waiting. So it just is a matter of time. But again, the first one is typically a little bit more longer in time. After you've been matched, you go into screening, where you travel to the intended parent's clinic for 1 day for a medical screening appointment. So once you've been matched, you'll be scheduled for your medical and psychological screening. Depending on what your clinic your intended parents are using, you may be required to fly there for a 1-day evaluation. You typically fly in the evening before, have your appointment, and fly back the next day. These are all things we coordinate, and no cost is passed to you. Again, if you want more details about the trip and expenses itself, you can go into our FAQ. But just while we're here, you're never responsible for any costs at any point. If you are with an agency that says you are, please call us. I'm just kidding. That's not, you should never be taking on the burden of any costs during this process whatsoever. During this appointment, you will complete pretty extensive, probably the most extensive medical evaluation you've ever had up until this point in your life. You'll have blood work, so you do have to be comfortable with frequent blood draws. Not only are you having blood work here, all the other monitoring appointments required of you during medication require blood work. So it is something to get comfortable with doing. Blood work includes STIs, make sure there's no drug use or drug history, your hormones, genetics, as we discussed, immunity, pretty much the full workup. I have a physical to make sure you're healthy and fit to take on this process, and as well as a transvaginal ultrasound, which includes an antral follicle count. This test is used to look at a woman's uterus, ovaries, tubes, cervix, pelvic area, the works. Transvaginal does mean it enters into the vagina and not an abdominal ultrasound that a lot of people think about. So that is the form of testing that is done also frequently, just as frequent as the blood draws in this process. The antral follicle count is to count your resting eggs in each ovary. This is a qualifying criteria for each clinic to make sure you meet. The screening appointment is not just for the intended parents, but it is also for you to make sure this is safe and healthy for you to do. You will not receive medical clearance if there are any concerns. The doctors will not push a donor through this process if it's going to be at risk to them or it's not going to be yield a healthy outcome. So even healthy people may not qualify in screening because they're looking for pretty superb hormonal and reproductive health. So this is an appointment where you get to discuss any questions you have with the medical professionals, and it's important to really take this time to evaluate your decision. The reason medical screening is before contracts is because this is the time to have any questions you have addressed by a medical professional before entering the commitment to continue forward. So if all goes well at your medical screening and everything comes back safe and healthy for you to proceed, you have medical clearance. At that point, you enter legal. So after you have been medically cleared, you'll proceed into legal. We will recommend an attorney to assist you and support you in reviewing your donor contract. Anonymous donor contracts are not required. Technically, only open or known contracts are required. As an agency, we require contracts for both, just as protection for everyone involved. It's just a good thing to have. We will provide your attorney and the intended parent's attorney with a set of guidelines for contracts. This means everything you agree to for the match will be given to the attorneys so we can have a smooth turnaround with contracts. Contracts are essentially, it's a very big document, but at the core of it, you're agreeing to your fee as well as your behavior and conduct during the process, as well as you're releasing your right to all the genetic material that is retrieved in the medical procedure. So once you have signed the contracts and been executed, you are now in legal clearance, and that legal clearance is sent to the clinic. That legal clearance sent to the clinic so they can generate you a calendar. For this step, you will start with what occurs during your normal monthly menstrual cycle. Because we are trying to create as many eggs as possible, your ovaries will be quite enlarged. It is vital that you limit activity from the start of medication until your period. So this is where your high school biology comes in. And Brooke has quite a bit of expertise in science, and I'll do my best to relay her wonderful slides. So a little bit quickly about the menstrual cycle, which you can do your own due diligence and homework, but I'll review this with you just to recap. There's the first phase of the 4 phases, which is menstrual, which is the bleeding phase. There's a drop in estrogen and progesterone collapses the lining of the uterus. This lasts about 3 to 7 days. Then there's the follicular phase, slightly overlaps with the menstrual phase. Begins on the first day of your period and ends when you ovulate. Follicle stimulating hormone from the pituitary gland stimulates the ovary to produce an egg from one follicle at ovulation. Then you enter ovulation. That's a more familiar word I think we're all acquainted with. This is the phase of your cycle where you can become pregnant. We all know that, I hope, at this point. If not, please review the graph in more detail and do your due diligence and catch up. Let's see. Luteinizing hormone, LH, surges from the pituitary gland, triggering ovulation to occur in the next 24 to 36 hours. Your ovary will then release a mature egg that travels towards the uterus. This phase occurs right about the middle of your cycle, day 14, if you have a standard, typical 28-day cycle. We all kind of vary within that range. It's not maybe always 28, but we do collect your average, most of us do. Your egg will then perish in 24 hours if it's not fertilized. Lastly, there's the luteal phase. This phase occurs after ovulation and continues until your period begins. During this phase, estrogen and progesterone thicken your uterine lining to prepare for a fertilized egg to embed and be nourished. If there's no fertilized egg, then estrogen and progesterone plummet and you get your period. All fun stuff. So again, recap where you need to, but this will help explain the medications and the stimulation that is ahead. You do not need to have a clear understanding of this to be an egg donor. This is just to make sense of what's to come. Again, the nurses and doctors are there for you at your screening appointment to answer any questions you have. So ovarian stimulation. During IVF, we try to obtain as many mature eggs as possible. Not every egg fertilizes or results in a good embryo, and not all are genetically normal. These medications are administered in order to mimic, control, and enhance your body's egg making. These medications are synthetic versions of what your body naturally produces during your cycle. While on these medications, you'll be having blood work daily to ensure you do not spontaneously ovulate, as well as to make sure you stay within a healthy hormonal range. These are some of the medications. These are brand names. They also go by other names. But these are the big ones that you see the most. Sometimes they are other names, like generic names, but these are the brand ones that you could easily look up. You just may be given different names or different generic versions at the time of your cycle. Follistim. I know this one very well. It is delivered by a small pen, so it is very tolerable and easy to administer in my personal experience. This medication contains FSH, that follicle stimulating hormone. As you recall, FSH is what stimulates your ovaries to produce an egg. A high amount of this synthetic FSH will be injected so you can create a lot of eggs. Again, this is self-administered injection, typically in your lower abdomen or the tops of your thighs. And you'll be educated on how to administer these medications by the nursing staff, as well as everyone here can give you some tips and tricks because we've all done them before. Menopur is another one. This medication provides follicle stimulating hormone and luteinizing hormone, which aids in egg maturation. Ganirelix, which is the prevention of LH surge, which is that spike right before ovulation. And then there's the trigger shot. This one does vary significantly between clinics. It could be HCG or Lupron or a combination of both, just depends on the clinic. Sometimes this is an intramuscular injection, but most of the time it is also subcutaneous like the rest of these. But you can anticipate perhaps a combination of subcutaneous injections and intramuscular injections that you do give yourself. The trigger shot is given at the end of your medications when your eggs are nearly ready to be retrieved. This is the last shot you do, and it's typically done around 72 hours before your procedure. That does vary based on the clinic, and this one is given at a very specific time. And then lastly, there is the egg retrieval itself. In my experience, I can testify this first bullet. The egg retrieval process only takes about 15 minutes. That's the actual time that the doctors are aspirating the follicles. The prep time leading up to your sedation and afterwards can be a couple hours, but you're in and out the same day. It is an outpatient procedure. Again, the clinic will review all of this with you in great detail. Make sure you're comfortable. You are under twilight sedation, so you don't feel anything while they're actually completing the retrieval procedure. Under ultrasound guidance, I will correct that. Needle is inserted into each follicle, and the follicular fluid is aspirated by applying gentle suction. Because of the sedation, you will need to bring a companion. So you do bring a buddy of your choice to accompany you to be your designated driver, as well as to be your safety person for the following day to make sure you are doing okay after anesthesia. You may experience some soreness, abdominal cramping, or spotting, which only lasts a few days. Everyone's experience is different, but those are the more common experiences immediately after a retrieval. And again, you do get to go home, or in most cases, your hotel, the same day. It is an in and out procedure, outpatient. That is it. Please contact us if you have any questions or concerns. Again, we've all been through this, and we want you to have a positive, rewarding experience. So give us a call, and we will guide you with any information you need. Thank you.